Thank you. I now recognize Dr. Auwaerter to give an opening statement. Thank
you. Chairman Wenstrup, Ranking Member Ruiz, and distinguished members of the subcommittee, thank you for the opportunity to testify. Though I'm from the Johns Hopkins University School of Medicine, I speak on behalf of the Infectious Diseases Society of America, and my statements do not represent Johns Hopkins. Over 1 million Americans have died from COVID, losses that magnify the tremendous suffering among countless families in our country. As a physician caring for patients with COVID for over 3 years, we need to deepen our understanding of the virus's origins and apply experience from the pandemic to improve our preparedness, prevent disease, and save lives. Investigations must be objective and driven by appropriate scientific and intelligence experts who present unbiased findings. Investigations are ongoing. There's no consensus yet about the virus's origins. The Department of Energy, with low confidence, determined the virus escaped from a laboratory in China based on classified information unavailable to the public. The FBI reached its conclusion with moderate confidence. On the other hand, many virologists believe compelling evidence points to an animal origin. They conclude that coronavirus most likely jumped from a caged wild animal into people at a seafood market. We may never know the origin conclusively. Making claims that cannot be supported sufficiently by available data only fuels confusion and mistrust. Regardless, we can learn valuable lessons from these investigations to prevent outbreaks and pandemics of any origin. A robust public health infrastructure and global coordination are essential for surveillance to identify, track, and contain potential threats. Pathogens respect no borders. We must collaborate internationally to foster an unsuspicious atmosphere where global information sharing about infectious diseases is transparent, complete, and rapid. 20 years ago, the SARS outbreak provides an instructive example of what can be achieved through multi-country scientific and public health collaboration. Within 6 months, these collective efforts were successful in staunching the virus, and it has not reappeared. Greater transparency about science, decision-making in public health will help improve health literacy and rebuild trust in science and public health, including understanding why recommendations evolve as knowledge grows. If people are better prepared to understand science, they will be more comfortable deciding how to protect themselves and their loved ones best. The U.S. should invest in an expert workforce to leverage preparedness tools to benefit all communities, meaning recruiting and training. Significant shortages of public health professionals, laboratory scientists, researchers, and infectious disease physicians persist. Federal investments are urgently needed to fill these gaps. Basic translational and clinical research are crucial for our pandemic preparedness. For example, rapidly deploying tests for a new pathogen will enable quicker scaling of testing capacity when new threats emerge. Investments should also focus on developing therapeutics for anticipated pathogens, including viruses and bacteria, including multi-drug resistant ones. Sufficient infectious diseases research capacity improvements to biosafety are essential. Access to BSL-4 facilities assists in biosecurity research. Therefore, new BSL-4 labs should be strategically placed throughout our nation. The federal government should support biosafety studies, including why laboratory accidents happen, their frequency, and other data needed to create and update evidence-based mitigation measures. Enhanced potential pandemic pathogens, EPP research, a type of gain-of-function research, has received renewed attention. Such efforts can help understand possible human pathogen interactions, assess the likelihood of emerging pandemics, and inform preparedness efforts, including surveillance and medical countermeasure developments. While such research is inherently risky, requiring strict oversight, there are risks if we don't undertake this type of research, leaving us unprepared. Unbiased bodies with appropriate scientific expertise should perform this oversight. Last year, the U.S. government charged the National Science Advisory Board for Biosecurity, NSABB, with reviewing policies regarding EPPP research and dual-use research of concern, DURC, In January, the NSABB released recommendations to strengthen the oversight of EPPP and DURC research in the U.S. and abroad, remove blanket exclusions, expand research types considered EPPP, strengthen guidelines, and increase transparency in the research review process. These guidances can facilitate achievements with improved appropriate guardrails. I am grateful for your attention and for inviting me. The Infectious Diseases of Society also thanks you for your leadership and stands ready to partner with you to learn from the pandemic and to improve our readiness.